That's okay, I can always edit it the first few
Just edit me out.
seconds. So welcome again, everyone. Good to see you again. Tanya, nice to meet you. We got another new person here tonight. So another holistic seminar, and I'll go over a little bit about what holistic dentistry means to us and why dentists and why we love her so much. It means we're committed to offering our patients the best treatment possible. By offering holistic dentistry, we're focusing on the prevention of dental disease and eliminating toxic dental materials that can be used in your treatments. Through a whole body approach, we're not just focusing on teeth, but are using the patient's biological framework to determine why their dental health may be compromised and how we can encourage healing and help prevent further issues. After the seminar, your names are going to be entered for a draw for an awesome prize. It's a 1-hour massage that's been donated by Ultimate Family Chiropractic and by an RMT, registered massage therapist. So without further ado, everybody knows Janet here.
Yes.
Hey. Hey. A little bit of background about Janet. Janet became a level 2 dental assistant in 2003, which led her into the world of holistic healing. She studied massage therapy and gained an in-depth understanding for the human body by studying anatomy, physiology, pathophysiology, and neurology. And she doesn't stop there. She goes on. She became passionate about learning about diseases and cures, prevention, and cures through a more natural approach. She then became a holistic nutritionist, and she's now enrolled in school with the Canadian College of Homeopathic Medicine, where she's studying to become a doctor of homeopathic medicine. Yay! Yay! Yay.
Awesome.
Take it away.
All right. Well, it's a little more comfortable this time because everyone here, I know your faces. And yeah. Well, I'm going to start. This seminar is on stressing less. The idea came from, I guess, just this time of year for everyone. It does become stressful. It's money. You're worrying about work, the hustle and bustle of the busy season. We can find ourselves worn out, tired, irritable, and simply just not ourselves. So, if you're here tonight, it's because one, you knew that I was cooking a turkey dinner. No, I'm just kidding. And second of all, you want to learn how to decrease some stress and anxiety in your life. So, inside your package, on the left-hand side, there was some stress tests, which some of you have already started, which is great. So I just want to explain what the purpose was of those. Which one is it again?
Just the right arrow, but it's been finicky.
It has?
There you go.
Okay, so if you want to go to your slides that I printed off for you, this is where I'm going to start. So I wanted to begin by addressing the stress in your life. Everyone's stress is different. We all have different lives. So the first one that I placed in there was to identify life's stressors. So this is going to help you recognize major life events that may increase your susceptibility to stress-related illness. The second one is on your coping mechanisms. This test is going to help identify how well you're coping with the stressors in your life. And thirdly is a symptom checklist. This is a list of stress-related symptoms. This will help in identifying the areas of your body that is affected by stress. So, for those of you who have already done it, great. I hope that you have an understanding now when you look at your scores as to where the stress is coming from, how you're coping, and hopefully take that information into the seminar that I'm doing tonight in decreasing the stress and doing positive things to make changes. So, this is where we thought it would be a good time for everyone to come up and just grab a plate and try some of the things that I cooked tonight. Everything that I cooked tonight is organic and related to, the foods that I use are related to decreasing stress, decreasing inflammation, and replenishing the nutrients that stress actually decreases in your system. All right, so if everyone would like to come up and try some stuff. There should be bowls there for the soup.
Yeah, they're right beside the soup. Yeah.
Oh, they are there. Okay. So go ahead. Don't be shy. If it's awful, tell me, because I won't cook it for my family for Christmas. This is just a little tester.
Okay, if we die on it.
Yeah. And later on at the end of the seminar,
You're not kidding. You actually cooked turkey.
I made a full.
I didn't think you were doing this.
Oh,
This is crazy.
yeah.
Wow.
It's
Yeah.
a dinner.
Full, yeah. So the soup is a butternut squash soup. There are some fruits and vegetables in it. Hopefully it is still warm. Yeah, it is. Okay, good. So, yeah.
It's a good day today.
I know.
It's a good
swell.
Do you want to describe which ones?
Sure. Okay, so that is the butternut squash soup. It's made with roasted red peppers, organic royal gala, and Granny Smith apples. There's ginger in it, different spices. It's great in the winter time for. It's great for decreasing inflammation, like I had said, in your system. And it's also a really nice comfort food. It is dairy-free, just so everyone knows, because I do cook a lot of my foods dairy-free. This is a free-range, organic-grown turkey. It was stuffed with herbs and fruits, vegetables. So there's white and dark meat. So instead of using a traditional stuffing, I decided to do a wild grain rice, and it is made with. I'm sorry. Did you just apologize?
No, I'm kidding. I'm being sarcastic. Like, you know, like high-end premium.
Sorry.
Good soup.
You like it?
Yeah.
Okay. Can I come for Christmas then, Clement?
That's awesome.
Okay.
You have to give me the recipe. Very good.
I will. All of the recipes, if you want them, let me know. I will email them to you. I just thought instead of printing off a bunch of paper.
That'd be awesome. Any recipes?
Yeah, definitely.
That's very good.
Good.
That's my next goal.
Good. I'm glad that you know.
Healthy cooking.
Yes, absolutely. Everything here, it's
Well, the stuffing looks so good.
yeah. So instead of doing a traditional bread stuffing, I decided to do, like I said, a long grain rice. There's cranberries, onions, apples.
What's in the soup again?
In the soup?
Yeah, you can taste so many different flavors. It's really
I know. So I roasted a butternut squash, and there's an onion, like a sweet white onion with a roasted red pepper, ginger, a lot of ginger. It's really good.
I think that's the ginger.
The taste.
The taste.
And there is coconut milk. So instead of using a base that's made with dairy, I decided to use coconut milk.
Oh, it's fantastic, Janet.
Oh yeah,
Thank
it's
you.
good.
So yeah, I will go over a little bit later as to what
And what do you eat?
do I eat.
Yeah.
Well, not right now, because I get the stressy anxiety butterflies before I do this.
I was going to say that.
All right.
Did you talk about the coleslaw? Because that excites me.
The coleslaw, yes. So it is made with
Oh, excited.
cabbage. Really gets her going. So inside the coleslaw is red cabbage, again apples. We have pumpkin seeds. There is onion, and I guess the sauce is made with raw honey, raw apple cider, which is great if you have any like intestinal digestion problems. It helps also if you have ulcers, acid reflux. So it is great at neutralizing the acid in your body. The raw pumpkin seeds are high in zinc, which is good for replenishing cells. Anything that has been in stress, it damages your cells and creates a lot of toxicity in the body, so zinc really helps push that out. Yeah, I guess. And then mashed cauliflower as opposed to mashed potatoes, which that's a tough one for me because I really like mashed potatoes. Yeah. So while you're all eating, I'm just going to continue because we do only have an hour. So if you've all done your stress test, you can take, like I said, that information and use it towards the rest of the presentation. So if we're going to talk about stress, we should know what exactly it is. So stress refers to any reaction to a physical, mental, or emotional stimulus that requires a response or alteration to the way we perform, think, or feel. So that is the Webster Dictionary definition of stress. We all experience stress from time to time. It is a natural thing. It's what gets us up in the morning. So, you know, owning a home, having to pay your bills, that's you having to go to work. Those are all considered stress. Change is stress. Are you okay? Ooh, just toss it in there.
Oh, in there? Okay.
No problem. So, we all experience stress, but it is not a problem unless Your response to it is negative. Your feelings and emotions are inappropriate for the circumstances. Your response lasts an excessively long time, or you're feeling continuously overwhelmed, overpowered, and overworked. And I'm sure that if we all think back to situations in our lives where we felt we were stressed, we could definitely elaborate on each of those 4 points. So, we're going to talk about next the different kinds of stress. And this was an eye-opener for me because I didn't realize that within yourself, like when I think of stress, I think, okay, well, you know, work, it's just so stressful, or this, you know, at-home situation is so stressful, but there are many different types of stress. So, physical stress refers to intense exertion, so overworking your body, manual labor, lack of sleep, or travel. Mental stress is, say, an example of that is perfectionism, worry, anxiety, or long work hours. Emotional stress is anger, guilt, loneliness, sadness, or fear. Chemical stress is drugs, alcohol, caffeine, or environmental pollutants, such as cleaning chemicals or pesticides, so that could even be work-related. Then we have nutritional, and that refers to food allergies, vitamin and mineral deficiencies. Traumatic stress, so injuries, burns, surgery, illness, infection, or exposure to extreme temperatures. Or psychospiritual, which is troubled relationships, financial or career pressures, challenges with life goals, spiritual alignment, and a general state of happiness. So those are all the different types of stress that one could be experiencing.
I have all.
I have all of those.
Yeah.
At one time or another, all of them.
I think, yeah, and I think everyone does too. Everyone
Combinations.
goes through certain stress situations in their
I
life.
think they take turns playing the like center role.
Oh, they're breeding.
Hog the stage, right?
So, I'm going to talk about stress hormones. You'll have to just give me a moment here. So, adrenaline, so that is considered, or it is the same as epinephrine. So, it is commonly known as the fight or flight hormone. It is produced by the adrenal glands after receiving a message from the brain that a stressful situation has presented itself. So you're driving along, someone cuts you off, or you almost get into an accident, you slam on the brakes. That feeling that comes over you, that's adrenaline being released by your adrenal glands into your system. So this hormone causes your heart to race so that blood can travel to the areas of your body that is needed the most. So it's like we're pre-programmed that when a stressor is faced, we know, our bodies know what areas of the body need to react first, and that's why your heart starts pumping out of control.
Is there a way, sorry to interrupt you, is there a way to control your heart?
No,
So
I don't
it just
think
does its
so.
own thing. So so if it's gonna pump, it's gonna pump.
That's
There's no way
right.
of slowing it down mentally or anything
Yeah,
like that. It
Do you
just
mean
does its
like
own
breathing
thing.
exercises?
It's
and that, or?
well,
Like you know when you get a adrenaline rush, like you feel nervous, or I do. I get
You
nervous,
can.
and it's like
you can do deep breathing exercises or diaphragmatic breathing exercises, but generally speaking, the way your heart pumps, it's from your autonomic nervous system, meaning we don't have control over it. It's the same as breathing. So when we're sleeping, we're breathing, we're not
it just does its
controlling.
own thing.
That's right.
Okay.
Yeah. All right. So, what is
If you
it?
stop, you know.
Oh, absolutely. Yeah. Well, maybe you won't know actually.
The one next to you will know.
Yeah.
So adrenaline or epinephrine also makes your body sweat to ensure you stay cool if you become overheated during a fight situation. So again, it's just a natural mechanism to keep you healthy and keep you alive during stressful situations. This hormone also affects your glucose levels. So what it will do is draw the sugar that is stored in your body to keep your energy levels up. So that is what adrenaline does. There's another one, norepinephrine, which is like 10 times the adrenaline. So what happens is when your body starts running out of adrenaline, this norepinephrine kicks in and just continues for that long fight. All right? So what I found interesting about norepinephrine is if you've ever been placed, I know like myself, if I've been placed in a confrontational situation, I feel as though I have a difficulty thinking. So what this hormone does is it sends a message to your body that says overthinking is going to be dangerous for you right now, and you have to go with your initial instinct. So basically, this hormone stops that brain activity and allows your body to do what it naturally should be doing in that circumstance. So. And last but not least is cortisol. This is a steroid hormone, and it is commonly known as a stress hormone. It is also produced by your adrenal glands. So this one takes a little more time, minutes rather than seconds, for you to feel the effects of cortisol in the face of stress. So this, in survival mode, cortisol is it's the life-saving hormone. So I guess if you wanted to look at it back in the day, when maybe the stresses we experience these days were present, if you were being attacked, say by a bear or something, and that last bit of fight that you have to try and save yourself, that's going to be cortisol. So I guess that's why they call it a survival mode life-saving hormone. It helps to maintain fluid balance and blood pressure, and it regulates some body fluids that aren't crucial at the moment. So it's responsible, cortisol is responsible for, if you've ever seen like a little kid that gets scared and they pee their pants, it's cortisol that causes that to happen. It stops the function of everything else in your system and puts it to what is needed. So that's, so if you see someone peeing their pants because they're so scared, it's actually, they're really scared. I would have to say. Okay, so the problem with cortisol is that if you stew on a problem, the body continuously releases it, and chronic elevated levels can lead to serious issues. This is where we come upon serious health issues due to stress. So if you're consistently under stress, cortisol is always going to be present in your system, and it's detrimental to your health. You're going to start having high blood pressure or heart disease or chances of strokes and cancers and diabetes. So
Does it cause digestive issues too?
absolutely, absolutely.
So cortisol can cause anything.
It can create irritable bowel syndrome, increase acid in your system, and that can cause, again, ulcers, and ulcers lead to stomach cancer. So you want to make sure that you're able to recognize stress and to find coping mechanisms to not let your body get to that point. So next we're going to talk about our physical reaction to stress. So the first stage that we experience is the alarm stage. So when someone experiences a stressful event, the area of the brain that contributes to emotional processing sends a distress signal to the hypothalamus, which is a part of our brain. This area of the brain functions like a command center, communicating with the rest of the body through the nervous system so that the person has the energy to fight or flee. So,
I'm enjoying it, sorry.
is it good, folks? You like it?
Yeah, it's good.
Good. Then I am invited for Christmas dinner now. I can come in.
Yeah, but you have to cook it.
Right. Okay, so we're going to talk a little bit about that part of the brain. So the hypothalamus, or command center, communicates with the rest of the body through the autonomic nervous system, which controls involuntary body functions such as what we were talking about: breathing, blood pressure, heartbeat, dilation or constriction of blood vessels, and the small airways in the lungs. After the brain sends a distress signal to the control center, it activates the sympathetic nervous system, sending signals to the body. So what happens is the hypothalamus, or the command center, tells these adrenal glands to start pumping out these hormones, the ones that we just talked about, into your body. So your heart beats faster than normal, your blood pressure rises, breathing becomes rapid, and the small areas in the lungs open up, so every last bit of oxygen available is used. Any extra oxygen is sent to the brain, and that is you're increasing your alertness in that moment. Hearing and other senses become a lot sharper as well. Meanwhile, the adrenaline triggers the release of glucose, sugar, that is stored in the body. These flood the bloodstream, supplying energy to all parts of the body. All of these changes happen so quickly that we are unaware of them. And once the adrenaline subsides, the brain will perceive danger. Once the adrenaline subsides and the brain still feels as if there's a danger, then that is when cortisol kicks in. And it will carry you through until the end, until the stressor is gone or it kills you, basically. But when the threat passes, then cortisol levels fall, and that's when you go into that fatigue syndrome where you're completely exhausted, tired, and it has depleted you of everything, like all of your nutrients and your energy. So the long and the short of it. Short-term symptoms of stress is immune dysfunctions, weight gain or loss, sleeping problems, stomach or digestive problems, headaches, backaches, and body aches. So if you are under...
I'm reading, I'm like, yeah, maybe.
Yeah. So short-term stress, you've had a really stressful week at work, or you were subjected to being out in the rain and the cold, and that's going to decrease your immune system, and you might be subjected to a cold if you were in cold way, like if you were introduced to those germs. Sleeping problems, so you're going to have restless sleep, or you're wanting to sleep too much and not feeling rested. And again, like stomach or digestive problems, we don't really need to go there. You know, if you're stressed, it works one way or the other. Headaches, and yeah, all of those symptoms are short-term effects. Long-term effects is cancer, diabetes, cardiovascular disease and stroke, and digestive problems again, but that's leading to more intense digestive problems, such as, exactly. Yeah, so it just brings on a whole other set of digestive problems. So now that we kind of understand a little bit of what stress is and what stress does,
Sounds crude. I got the two first.
You got the two first.
Getting sermon.
Oh dear.
Diabetes. Oh well, I'm fine. I'm here.
Good attitude.
That
Good
is a
coping
stress-
mechanism. Good attitude.
That's a stress-free way to look at it. So the stressless detox, when I was trying to put together some sort of a program to stressing less, I came across this article about research that shows it only takes 3 weeks to create a new neural network in your brain to help regulate stress. And it said that if we focus on these 4 areas of our life, which are love and relationship, success, higher consciousness, and health and well-being, that we will be able to come to a calmness, I guess, in our lives. So it's addressing each of those 4 things in our life and creating a balance with them. So in order to do that, we need to identify what is causing stress in our lives. So what you can do is monitor your state of mind throughout the day. If you feel stressed, write it down, your thoughts and your mood. So I suggest carrying something around with you and writing down throughout the day whatever you notice is causing you to be stressed. Once you know what is bothering you, develop a plan for addressing it. So this could mean setting more reasonable expectations for yourself and others, or asking for help when needed. So make a list of all of your commitments, assess your priorities, and then eliminate any tasks that are not absolutely essential. Can you relate?
Delegate to Janet.
Which she does daily. No, just kidding. Another thing we want to do, which is where I come into play, is nourish your body with healthy foods. So this means eating 50 to 75% raw foods. If you're under stress, you don't want to cook the nutrients out of your foods. You want to eat as many as raw, and I suggest juicing, if not every day, every other day. You want to avoid caffeine, alcohol, processed foods, pork, red meat, which is a tough one for me, and drink fresh, clean water. So perhaps for those times in your life, maybe stay away from tap water and make sure that you're getting a good, clean water. Another thing is exercise. So inactivity is proven to cause anxiety. So I thought this was a great example because I have a 4-month-old puppy at home who has hyper issues. But, so an example of exercise is what we see in dogs. Dogs that don't run or get sufficient exercise suffer from psychological problems and stress. So human beings are a lot the same way. If you're not exercising, you're not releasing those feel-good hormones and decreasing stress and anxiety. So it's a really good idea to get out at least once a day for 30 minutes, whether it's a good stern walk, going to the gym, joining a sports club, doing whatever it is you have to do to start exercising every day. Human beings were meant to be active, but we are living in an increasingly inactive world. So we need to remember that. And the last one, do things for you. Whether it's taking an art class, ceramics perhaps, or joining the sports club, or take up knitting, I don't know. Just anything that makes you feel good about yourself, that shows yourself having a sense of accomplishment, which was, in relation to that was a big one for me, as I found that I was focusing too much on everyone else and not worrying about myself. And recently, like, I started painting again, started knitting again, reading, just taking that little bit of time every day to do something for me, so I had that feeling of self-accomplishment. So 21 days, and you can reset your minds.
So literally physical neural networks
Neural networks, yes.
can be rewired.
Exactly.
So
And that,
state of mind
yeah.
and physical state.
And that's the same
That's crazy.
with negative attitude.
Yeah,
If you
that's-
are a
it must
negative
apply.
person,
Yeah.
or you find yourself becoming a negative person that doesn't really have a lot of nice things to say either about themselves or other people or about your life, literally every single day telling yourself, remembering 3 good things that are positive about yourself every day, do that for 21 days and you will start to see a positive change in how you feel about yourself, how you feel about life. So it's all about training your brain.
I have a question. What do you do if you work with a person who is one certain way your boss? But she's the type of person, or me, myself, and I pass first. I don't care what you do, what you say, or what you're going through. And always negative and put you down. Killer.
Yeah.
We'll call that Plan B.
Just call me Pig Farm. No, just kidding.
Okay, thank you. I'm going to pick it up.
So, what do you do with a negative? Is it a boss or coworker? Because that
The co-worker can be fixed.
right, exactly.
Excuse me. A boss
So a
is a different
boss.
ballgame.
Well, if you need the job, then you're going to have to do it yourself because you can't change somebody else.
No,
So you
that's
have
impossible.
to. That's right. So you have to find a way within yourself to deal with that situation. When I have somebody that treats me like that is of an authority, I look at it as in, I feel sorry for you. That this
Yeah,
is
that's exactly it.
This is the person that you have to be to get through life.
Mm.
So that's one way of looking at it. Another way is just making sure that it doesn't become, say, a harassment issue. You know, and if it does, then you would have to, if you feel comfortable addressing it to somebody higher up than that person.
Did that. Didn't work.
Yeah,
It seems to be a common story nowadays too.
Yeah, they don't,
Yeah.
they seem, even if you go higher, they don't want to get involved.
right.
And they agree with that person and they are too narrow closing to be able to see what's going on.
Right.
HR. Do you have HR? Is there an HR department where you work, or?
Oh no, if you do that, you're in trouble too.
Oh my. That's almost like when you have to step back, don't take it personally, literally do your job and then go home.
Yeah.
Like, nothing else.
You almost just
That's it.
have to have, like, if you need that job, you have to just kind of have that narrow mind towards
Never mind.
and just
Yeah.
kind of look forward and remember what you're doing it for. Remember the positive things about why you're going to work that day. It's basically you just have to look at it as you
What I
can.
do is, I say, oh, she come and I say to her, you look good today. And she's okay for the rest of the day. She's out of my hair.
Hey, there's your answer then.
You just need to butter her up.
Those aren't prickles at all.
She's so conceited.
Janet, what's a pure water that you said to drink? Like you said, don't drink tap water. Like,
Oh, just drink something that's.
like is Home Depot and Kirkland okay?
Yeah, just drink like a.
I was always curious
I don't
if
always.
that's any good.
Do you know what I suggest doing is, and I have one in my home, I had one put in, is a reverse osmosis.
Yeah, I heard
filter
that, but I'm in
system.
an apartment, so I don't know
Oh,
what,
you
but I
can't
don't
do
know what I
that.
can do.
Yeah,
I used to have a thing on my tap, but
yeah. That's because I bottled water myself. It's you're creating kind of pollution by constantly bringing those into your home and using them. And plus, bottled water sitting like this, you don't know where it's.
Yeah.
You don't know how long it's been sitting in the sun, and you know. Anyways, yeah. My alternate suggestion is a reverse osmosis system. Otherwise,
where can you buy
You
them?
guys offered-
Like I can't buy the
Highly
machine, I don't have a house.
right. Well, then what I
You
would
still have a
suggest
water
doing is a
station.
water cooler, and then refilling a canteen.
Oh, that's
What do you mean?
Like getting a
We
water
did
cooler
have
and then getting like a big, sort of like a separate, you know what I mean? Or going to a depot and
Wasn't it
filling
right
them up. There's a
Yeah,
water
like
really
do
gonna
water
set up
depot too.
Sure, it's fine.
So do water depot without the Kirkland, not the
Yeah,
bottled water.
not the bottled water, yeah.
Had
do-
reverse
So Home Depot is okay?
Sorry?
Home Depot is okay?
Yeah, the water depot, yeah, for sure. Yeah.
Water Depot, Home Depot.
Yeah. All right, so we're gonna talk about the feel-good hormones. We're gonna start talking a little bit more about the positive effects that our body has. So the first one is serotonin. This is sometimes called the happiness hormone. It regulates your mood, prevents depression, and makes you feel happy. It can be released by getting exposure to sunlight, by eating foods rich in carbohydrates, and by exercise. So going to our dinner tonight, the rice stuffing is a good example of a good complex carbohydrate for releasing serotonin in your body. Also, citrus or fruits. Lots of fruits are a good, positive,
Very
complex
good supper.
carbohydrate. Thank you.
Very, very good.
Thank you.
Thanks for supper, Janet.
You're welcome.
Very good.
It's a little weird.
Can I ask what favorite